And this is Dr. Jolene. I'm a clinical nutritionist, and today we're diving into a topic that isn't spoken enough about: men's fertility and nutrition. Did you know that 1 in 3 infertility cases are due to male factors alone? And nutrition plays a very powerful role in improving sperm quality, testosterone levels, and overall reproductive health. If you're watching this live, drop a thumbs up in the chat box or tag somebody who needs to hear this. What's the current reality about male infertility? Number 1 is low sperm count. Then we have poor quality sperm, erectile dysfunction, and also hormonal imbalances, especially with insulin levels, cortisol levels, and testosterone levels. Some of the major causes that I have identified as a doctor and a clinical nutritionist are stress, sedentary lifestyle, smoking, alcohol consumption, a poor diet, a lot of processed food, overconsumption of sugar, nutritional deficiencies. Just like we need to build muscle to boost our immunity, we also need to eat to support our reproductive health. Today, I also want to bust a few myths about men's fertility. The number 1 myth that I come across is that infertility is mostly a woman's issue. Did you know for a fact that male factors contribute to 40 to 50% of infertility cases? It can be the sperm quality, it could be the motility, it could be the hormonal levels, and lifestyle has a huge role to play. Myth number 2: if a man can ejaculate, he's fertile. Not necessary. The fact is that if you can ejaculate, you does not mean that you are fertile. Sperm count, motility has a huge role to play for healthy conception. Next, only women have a biological clock. The fact is, while a man can technically father children later in life, sperm quality declines after the age of 35 or 40, increasing the risk for having a miscarriage and also genetic issues in the child. Myth number 4: taking testosterone supplements boosts fertility. Absolutely not. No external testosterone can actually, magically increase your sperm count. Always test, get your levels checked, and follow natural methods first instead of going for, testosterone supplements. The next myth is that diet does not have any effect on my sperm health. Well, diet impacts the hormones, the DNA of your sperm, and overall sperm production and reproductive health. A better diet will always contribute to having better sperm count and sperm health. Boxers versus briefs doesn't matter. Tight underwears and heat around the testes can impair sperm production, and that is why you should be opting for some breathable fabrics. Now, these myths keep men from getting help, so we need to change it. Men can get help, and especially if you can consult somebody who can modify your lifestyle, take that help. Now, what are the 5 key nutrients that are needed for male fertility? Number 1 is zinc. It not just helps in sperm production, but this can help you boost your testosterone levels. The common sources of zinc are your pumpkin seeds. If you're a vegetarian, then nuts, pumpkin seeds are your best source. Also, lentils and pulses do have a good amount of zinc. Eggs are also a good source of zinc. Vitamin D. If you're tested with low vitamin D levels, this is definitely going to affect your testosterone and sperm motility. Now, of course, I would say get yourself exposed to sunlight for about 15 to 20 minutes every day in the morning. You can have eggs, all sources of good fats such as ghee, eggs, nuts, seeds are a great source of vitamin D. omega-3 essential fats. Now, all our fish is packed with omega-3. So get yourself to eat fish more often. If you don't want to eat fish or you cannot eat fish every single day, you can have walnuts, you can have flax seeds. These are also really good to improve your sperm count and motility. The next very important nutrient, it's a micronutrient, is folate. It helps to, improve your sperm DNA. Now, what damages sperm DNA? Alcohol and bad lifestyle can damage your sperm DNA. So folate, in fact, helps to repair the damaged sperm DNA. It'll help. And of course, your sperm gets produced every 3 months, every 72 to 90 days, you have new sperm. So include folate as a part of your diet. And lastly, selenium. It's an antioxidant which helps to improve sperm count, and the greatest source of selenium known to us are Brazil nuts. So even 1 or 2 Brazil nuts every day will really help to boost your reproductive health. What should we avoid or what should we reduce in our foods? Number 1 are processed foods. Anything that comes out of a packet, a box or a tin, especially processed meats. They have a lot of sodium content, they have a lot of preservatives, a lot of taste makers added to them, which will affect your sperm health. Excessive amount of sugar. Not our natural sugars, not the sugar that comes from your fruit. We are in the mango season, so don't stop eating a mango. That mango is actually going to help to improve your reproductive health if you eat it in the right way. So when I say excessive sugar, I mean, again, all the processed, ultra-processed packaged food, including the food that says low calorie, zero sugar, low fat, diabetic friendly. Stay away from that. And lastly, alcohol. It reduces sperm count and it causes a lot of hormonal imbalance. It affects your liver. So be careful and stay away from alcohol. What I suggest in my 100 days program is actually a lifestyle upgrade that will help to boost your fertility. And number 1 on that list is weight management. Obesity directly impacts your testosterone and your sperm quality. Next, quality of your sleep. Even 6 hours of sleep. But if it is disturbed, if the quality of your sleep is not so good, it will reduce your sperm count. Exercise, regular workouts will help to boost testosterone. Now, instead of having pills or instead of taking testosterone shots, I would say work out at least 30 to 45 minutes and have a variety in your workout. You could do a little bit of high intensity cardio, you could do strength training, you could do weight training, have a mix of exercises in your routine. And lastly is stress. And this directly lowers testosterone level. So when your cortisol level increases, that is your stress hormone increases, it'll lower your testosterone level. So I would say consider meditation, a little bit of breathing, walk outdoors, go to the beach if you have access to a beach, go there, spend some time, and it'll help to calm you down. I once had, a male client who had low motility, borderline testosterone levels, and we worked just on reducing his junk food. We added zinc-rich foods to his diet and we corrected his sleep. And within about 2 months, his sperm analysis really improved. So my top tips for today, number 1 is start with Brazil nuts. Have 1 or 2 Brazil nuts daily in the morning as soon as you wake up. This will boost your thyroid levels. It'll help to boost your testosterone because it is very rich in selenium. The next tip is have about 2 tablespoons of roasted pumpkin seeds. Maybe you could just have them plain, or you could add it into your into a ragi porridge that you're having in the evening or even as breakfast. Have 2 eggs every day. You could space it out. You could have 1 egg in the morning, 1 egg in the night, or somewhere in the afternoon, but try and have at least 2 eggs every day. Do not forget to include fish at least twice a week. Or you could throw in a fish oil supplement if you're not really fond of fish. And lastly, make sure that you cut out all that processed food, refined sugar and alcohol for at least 4 weeks to see the difference. I get a lot of questions, and this time I got a load of questions that a lot of people had over Instagram and over Facebook. So I'm going to take a few questions today, and those questions that have not got answered, you can DM me directly after this live, and I will make sure that I answer them through my stories. This question has come, and it says, can men really improve sperm quality through food? Yes. Sperm regenerates every 72 to 90 days. And nutrition can improve the motility, the morphology, that is, it can even correct the sperm DNA, and this can happen within 3 months. The second question. Is protein powder bad for fertility? Now, I know a lot of people have a lot of doubts about protein powders, and yes, you should be doubting it because there have been a lot of scams related to protein powders. But if you can, get guidance and help from a professional, and they suggest you a good protein powder without any artificial hormones, without any added sugars, you get clean whey protein, I think that would be the best for you. Avoid using a protein powder which has soy in it, but a whey protein would definitely help to improve your fertility. The third question, does coffee affect my sperm count? 1 or 2 cups a day are fine. It's not going to do anything bad to you. But if you have excess of caffeine, especially if you start your day in the morning with a cup of coffee instead of, eating a banana or having those Brazil nuts, that's definitely going to affect your gut health. And this is going to impact your hormonal levels. It's going to also impact your the sperm count. So make sure that you don't start your day with a cup of coffee, and don't have coffee post 6 o'clock in the evening. But up to 1 or 2 cups a day are absolutely fine. Can alcohol and smoking affect male fertility? Definitely. Both reduce testosterone and it also damages sperm DNA. So it is best that you kind of avoid, or you cut down on smoking and drinking. Is there a fertility boosting supplement men can take? Well, there are a lot of whole foods, but key supplements, definitely, I would say get yourself checked first, get your vitamin D levels tested, and, take help from a professional. You can introduce a zinc supplement, vitamin D, omega, and also CoQ10. These are some that really help with, your testosterone levels, sperm count, and motility. I think I've already taken this question. Do tight underwears or laptops on the lap reduce fertility? Yes. So heat affects sperm production. So wear, breathable fabrics, and avoid keeping your laptop on your lap. Use a desk. And lastly, does age affect male fertility? Yes, of course. After the age of 40, sperm quality begins to decline. But nutrition and lifestyle can still make a big difference. All right, so I've come to the end of, all the questions for today, and these were some of the top questions that I thought that I should take up. Now, if you've got 1 or 2 questions that I haven't answered, drop them in my messenger, or on Instagram, or you could also WhatsApp me, and I will make sure that I answer them soon. Thank you very much, everybody, for joining in today afternoon. It was a lovely session, and I really appreciate that you took out the time to be here. If you have learned something new today, or you think that this video could help somebody, a couple who's trying to conceive, or somebody who's going through an IVF or an IUI treatment, don't forget to share this video with them. My name is Dr. Jolene Fernandez. I'm a clinical nutritionist. I'm based in Goa, and I'm also available for online consultations. Thank you so much, guys. I will see you all next week with another live. Till then, bye-bye. Take care.